Okay, this is the patient assessment cardiac version. So you'll get dispatched to a residential house for a patient with chest pain. And okay, so we'll go. So I'll have my BSI on. Our scene is safe. We have one patient. We'll consider ALS. This is a nature of illness based on the dispatch information, and we will consider C-spine. We won't rule it out yet. So as I arrive on scene, I see a 30-year-old male patient, Caucasian. He looks to be in moderate distress, holding his chest. The environment is a clean residential home, and I don't see any life threats that I need to address right now. Sir, my name is Dave from MATC. What's your name?
Scott.
Scott, do you know where you are right now?
Yes, I'm at work.
At work. And what time of day is it, Scott?
About 9 o'clock.
About 9 o'clock. And who's the president of the United States?
Trump.
Trump. And what's going on today? Why did you call us?
A little bit of chest pain.
Okay, so he has a chief complaint of chest pain. His airway is patent. I'm going to rule out you didn't fall or anything, have any trips?
No.
I'm going to rule out the need for C-spine. Scott, how's your breathing?
It's okay.
Okay, so he looks like he's a little labored, so I'm going to hook him up to some oxygen. Quick lung sound check. Lungs are clear. Good chest rise and fall. Scott, I'm going to check your pulse real quick. Pulses are strong and regular. Skins are warm, pink, and dry. Visual sweep for any bleeding. I don't see any, so there's no need to intervene there. I don't need to expose right now, but I will expose shortly. And because of his age, it could be cardiac, could be anxiety, could be a muscle issue, could possibly be a breathing issue. But we're still going to be a high priority load and go patient, and we're going to do a little bit more assessment here. So Scott, when did your pain start?
About 20 minutes ago.
20 minutes ago. And is there anything that makes it worse or lessens it?
No, it's just kind of constant.
Okay, and Scott, if you could describe this pain to me, how would you describe this pain?
Like a kind of like a tight, crushing kind of pain right here.
Okay, and Scott, does that pain go anyplace else?
Kind of out to my arm a little bit.
All right, and on a scale of 0 to 10, 0 being pain-free, 10 being the worst pain you've ever had, where would you rate this pain?
It's an 8.
Gotcha. And Scott, what were you doing before this started?
I was running.
Okay, so he was running. So my signs and symptoms are chest pain, an 8 out of 10 on the left side, a little difficulty breathing. Scott, do you take any medications currently?
None prescribed, no.
And any allergies?
No allergies.
Okay, any pertinent medical history?
I'm supposed to go to the doctor because of some heart issues I've been having.
Okay, and last oral intake?
I had breakfast at around 7.
Okay, and one more time, what were you doing before you called 911?
I was out running.
So out running, okay. I'll get a set of vital signs. So a pulse, 100, blood pressure, we'll say 130 over 70, respirations of 18, lung sounds are clear, pupils are pearl, pulse ox, 96% on oxygen. We'll hook them up to the EKG monitor, showing a normal sinus rhythm. We'll check a blood sugar. We'll take a temperature. And my field impression is I think it's something related to cardiac issues, but I'm still not sure that it's strictly related to his heart. So my secondary assessment pertinent to this, I might expose the chest area and look at his chest to see if there's any bruising or any swelling. I'll do a complete lung sound check. I'll do a 12-lead EKG, and we'll give Scott some aspirin. So this is going to be aspirin, Scott. I want you to take. Do you have any? So this is the right patient. I'm going to give this to Scott. It's prescribed to me. I can give it to per protocols. And this is aspirin. The dose is going to be 4 81 milligram tablets. Route is we'll have you chew these up. And the time would be right now. So I'm going to open up the aspirin, Scott, so chew this up. You have no allergies to aspirin?
No.
Okay, my medication is not expired. Everything looks good, so go ahead and chew up the aspirin. And again, this is okay to give him per my protocols. So my reassessment en route to the hospital, we're going to reassess the primary assessment, so it's ABCs. We're going to redo the secondary assessment and focus assessment, so we'll do his lung sounds. We'll keep an eye on the monitor. We'll do vital signs every 5 to 10 minutes based on my findings from the EKG and how his pain level goes. And then we'll evaluate his response to treatment. So we'll see how the oxygen is going. We'll keep an eye on the pulse ox, and we will also keep an eye on his pain level and see if we can treat it as we go en route to the hospital.